So the residency interview, I think, is probably the singular most important step. So as you guys imagine, most programs get, it depends on the size of the program, but they generally get 1,000 plus applicants. In our hospital, my program, we get about 2,500 to 3,000 applications a year. And as you can imagine, that's for 18 positions. And so we narrow that down. But once you get an interview, what that means is myself and the faculty that reviewed the applications, we think that you are somebody that on paper we can take, right? So some people, they come to the interview and they feel a little bit like they feel like maybe they don't belong in there, like imposter syndrome, right? They're like, well, I have an attempt on the USMLE. Why am I in the same room as the guy who's from NYU who has 250, right? Well, if you have the interview, that means we thought on paper that you're somebody that can fill a spot. So be confident, and this is the time to shine and impress. And then that means you're one of 300 people that we can potentially take. So that's, you want to make sure that you say the right things, you present your way in the best foot, and leave the best impression possible so you have the best chance.
Dr. Weissman, do you have anything to add to this?
Yeah. Just, I guess, to echo, what Dr. Artut was saying, I pulled up a survey, when we were talking about kind of putting this together for the students, and I'm reading off the survey here. So they interviewed about 100 program directors inside the network in Jersey, and they ranked out of importance, and I'm talking about how important is AOA, honors, the dean's letter, the LORs, the gaps in medical education, professionalism, ethics, research, and they ranked them out of 5. I'll read you the top 3 on the list that all the program directors put together. So number 1 is interaction with faculty during the interview day. That was number 1, ranked 4.8 out of 5 importance. Ranked number 2 importance was interactions with residents during the day, interpersonal skills from interview day. So out of the 20 or 30 things that they ranked, these were the top 3. So what Dr. Artut was saying is factually correct over not just myself or other, but like hundreds of program directors, that they feel that the way students act with the faculty and the residents and the skills they show on interview day is actually the most important factors, which will say, are we ranking this person? And if we are, how high? So very, very important, and do everything you can to get it right.